41 now. Welcome back. The first part of Governor DeSantis' order to reopen Florida goes into effect on Monday. It allows elective surgeries across the state to start back up, and that includes ones in the dentist's office. But what can you expect next time you go to the dentist? Joining us now by phone is Dr. Cary Berdy. He's a dentist with Berdy Dental Group. Dr. Berdy, good morning, and thank you for joining us this morning.
Thank you so much for having me on.
Exciting times for dentists across the state. How excited are you to start your business on a more normal level come Monday?
We're absolutely excited to get going again and starting to treat our patients. There's a lot to look through when it comes to the proper protocols and recommendations, but we're both examining the governor's orders as well as the CDC recommendations to make sure we have a full picture of what's expected of us and what's safest for our staff and patients. We've only been seeing emergencies as of late, which has really been great because it's given us the opportunity to make sure that we're proactively preparing for eventual reopening, which hopefully will happen very soon. We're planning on opening on May 11th, and we wanted to take a few extra days next week to make sure that we have the proper health procedures in place and that we're actively taking steps to prepare to make sure that we can safely welcome all patients back into our office for treatments.
And so we're clear, your office will not resume business until May 11th. It will not start on Monday.
Correct. Yes, we're still going to be open for emergencies, but we plan to do a full opening on the 11th. We may open a little bit sooner, but we really wanted to take time to make sure that we have the proper protocols and procedures in place, that our staff is properly trained on all the new things that we want to do, such as taking patients' temperatures before they enter our building. We've done additional steps to add in additional filtration into our systems. We've always had UV light filtration to help with contamination in the air systems. We've had that for probably 20 years already. We're also doing a few additional things, such as adding barriers in our reception area at the checkout areas, similar to what you've seen in grocery stores. We're going to be limiting the amount of people that accompany patients. Hopefully nobody does, but if they need to, just limit it to one. We're going to be taking extra precautions, screening patients. Obviously, if you're a patient and you don't feel well, there's no reason for you to come to the dentist. You need to come see your physician first to make sure that you're well before you have dental procedures done. But we're also making sure that our staff is really fully trained on as far as using the protective equipment properly, like we always have. We've always been either meeting or exceeding the needs that the CDC and the American Dental Association puts out as far as sterilization techniques, making sure that we have a safe environment for our patients as well as our staff to work in.
Yeah, all really great information. You know, one thing that I've been fascinated with during this pandemic is talking with medical professionals such as yourself, talking to other doctors, and it'll be interesting to see what sticks moving forward 6 months from now that was sort of developed out of precaution and caution of this pandemic.
Absolutely. You know, we've as dentists, we've always been at the forefront as far as wearing protective equipment and sterilization techniques. Even, you know, going back decades, we've always wanted to meet or exceed everything. And it'll be really interesting. You know, we're taking really close look at everything that's recommended from the CDC as well as the American Dental Association and our local dental societies as well. Things are changing rapidly, but we're definitely on top of it, making sure that we can provide the best care and a safe environment for everybody. We're really big believers in preventative care at Berdy Dental Group. So it's really important. We want our patients to know you do need to come see us. Even if everything seems fine in your mouth, we want to make sure that we're looking for undiagnosed issues such as oral cancer, gum disease, cavities. These are all things that may not necessarily hurt you, but they could be going on, and we don't want those things to go undiagnosed. The sooner we can treat those things, the better off it's going to be. And certainly we want to make sure that we've got the best environment to treat you in, and we're doing everything we can to ensure safety.
Dr. Cary Berdy, we appreciate you taking the time to talk with us this morning. Really quick before I let you go, for people wanting more information, where can they go to learn about your services?
Sure. Please feel free to call us anytime. Our phone number is 904-376, or you can visit us at our website at berdydentalgroup.com for more information.
Dr. Berdy, thank you very much.
Thank you so much.